My name is Dr. Gary Ferguson, and my specialty in University Orthopedics is total joint replacement. Really, we're talking about replacement of worn-out hips and worn-out knees. The advance of orthopedics is the advance of technology itself, in really all disciplines in healthcare. Advances in anesthesiology, advances in materials science and manufacturing, advances in basic science in our own discipline, and the experience of surgeons who have worked with implants as they've evolved and carried down techniques, all have really combined to evolve orthopedic surgery. And actually, it's just a beautiful time to be involved in orthopedic surgery because all of the things I just mentioned are really coalescing and have in the last 10 years. And as they do, progress has really advanced at what would be called an exponential rate. Patients teach doctors all the time about what could be done, what should be done, and cause us to apply these techniques in a new way. I also do a lot of arthroscopic surgery to treat what you might call mid-range degenerative conditions of the knee. It's very commonly done, this arthroscopic chondroplasty, as it's called. It's really an advent that's been around for over 20 years, over 30 years, but its value is in a quick recovery to just help really tune up the knee. All it simply does is smooth out a worn surface. So arthritis, after all, is wearing out of the cartilage coating on the end of the bone. And it becomes cracked and peeled, much like paint on a wall. So the arthroscopic surgery simply trims that away. The patient will still have arthritis at the end of that, but the quality of the gliding surface is improved, and pain can be managed much better for sometimes several years after such an operation. It takes 20 minutes. Folks go home the same day and can climb stairs at home that same evening. A lot of patients, when they hear about a total knee replacement, they think that a common misconception is that this means chopping out gigantic portions of the knee and all of its anatomic purity, putting in a nuclear-powered battery or so, and hopefully it'll all work when you press the on button. That's nothing really like that. Complicated is done. A total knee replacement is simply a cap on the end of the thigh bone and a cap on the end of the shin bone, so that we now have artificial surfaces gliding on each other. But nature is still powering these surfaces. It takes an hour and a quarter to do surgery like this, and we have patients standing up the next day. I have had a patient, for example, a 45-year-old woman who really was wheelchair bound because of the arthritis was so advanced in both her hips and her knees she could not walk. So we did one hip replacement and changed things over during the same surgery, did the other hip replacement, and had her standing up the next day. And within 6 months had enough strength to get herself into the car, drive to her work setting, get into that setting, walk in there, commiserate with her employees, do the work that she loved, and walk home. And this is with a cane, if she wanted it. She limped a little still. By 1 year, she was limp-free. Everyone has their reason for wanting to participate in life's gifts, and hers was to participate in this setting with her co-workers. When they come to my office a year later and they walk in, well, geez, you know, I'm at least as lucky as she is. The burden of chronic pain is huge, and it goes far beyond just the physical reality of a hurt hip or knee. Depression is a common side effect of having such pain, and the incapacity to resolve it. To have that burden lifted is not just a benefit of pain relief at the joint, it's the burden of chronic pain that anyone knows what I'm talking about when they have it and feel very disabled to the point of having to use a cane or a crutch or depending on medications daily and still struggling. When that source is resolved and patients become pain-free, they are like kids who rediscover again, you mean I guess I can actually do this. It causes them to engage life in a way that they were sure they had lost. And really, that might allow some patients to return to a work setting. It might allow some patients to engage with grandchildren in ways that they couldn't imagine in some other setting. It might allow someone to drive a car who couldn't before, who could now complete their lives or live their lives in a much easier. The burden, really, of chronic pain in the hip or knee affects every moment of every day. And the idea that you could lift that with a total joint replacement is, well, it's quite a gift. Patients are elated. They don't have to tell me. I can see it in their eyes, you know.